Today let us discuss about the femoral triangle. We have dissected out the femoral triangle of the right lower limb. Let me now give you the orientation. This side is the medial side. Here is the lateral side. This is the superior aspect. This is the inferior aspect. Coming to the femoral triangle, it is also called as triangle of Scarpa. It is situated in the upper 1/3 of the thigh, just below the inguinal ligament. Coming to the boundaries of the femoral triangle, it has got one base, one apex, two borders, medial border and lateral border, one roof and one floor. Let us discuss the boundaries in detail. Let us now look at the lateral border. The lateral border is formed by the medial border of the sartorius muscle. The medial border is formed by the medial border of the adductor longus muscle as it slopes backward and laterally. The base is formed by the inguinal ligament. The apex is formed by the meeting point of the medial adductor longus and the lateral sartorius. And the floor is muscular, and from medial to lateral it is formed by adductor longus, pectineus, psoas major and iliacus muscle. Now let us discuss about roof, which is formed by skin, superficial fascia and deep fascia, which is called as fascia lata. We have already removed. Here we can see an important structure which was present in superficial fascia called as the great saphenous vein. Here you can see the great saphenous vein joining to the femoral vein. Let us discuss the content of the femoral triangle. The main contents are femoral vein and its tributaries, femoral artery and its branches, femoral nerve, deep inguinal lymph nodes and lateral cutaneous nerve of thigh. We can also see fibrofatty tissue and femoral branch of genitofemoral nerve. Here we can appreciate from medial to lateral we have the femoral vein, femoral artery and femoral nerve. From medial to lateral you can use the mnemonic van structures, vein, artery and nerve. Now let us discuss about the femoral sheath. It is a funnel shaped fascial sheath which encloses the upper 3 to 4 centimeters of the femoral vessels. The femoral sheath we have removed here. It is divided into 3 compartments: medial, intermediate and lateral compartment. The lateral compartment will contain femoral artery. The intermediate compartment contains the femoral vein, and the medial compartment here contains the deep inguinal lymph nodes, and this compartment is usually the smallest of all 3 and is known as the femoral canal. Now let us see about the femoral nerve. It is the chief nerve of the anterior compartment of the thigh and also the largest branch of the lumbar plexus, and arises from the dorsal divisions of anterior primary rami of L2, L3 and L4. The femoral artery is the chief artery of the lower limb. It is the continuation of the external iliac artery and it enters the femoral triangle behind the inguinal ligament at the mid-inguinal point. It gives superficial and deep branches. Here we can appreciate one of the deep branch, that is profunda femoris artery. Near the base of the femoral triangle, the artery lies lateral to the femoral vein, whereas in apex, the artery lies anterior to the femoral vein. Clinically, femoral artery is very important. That is, the pulsations of artery are felt by the clinicians in the femoral triangle just below the mid-inguinal point. Since this artery is quite superficial in the femoral triangle, it is the preferred artery for cannulation and for injecting dyes for procedures like angiography. Clinically, the femoral triangle is important because it is a site for femoral hernia, psoas abscess and palpation of the femoral vessels and lymphadenopathy.